Hello and welcome back to the episode number 1 of season 2. Our focus this season will be on trends influencing the transformation of the healthcare as we know. I will discuss the challenges currently faced and the future of healthcare with various industry leaders across the care spectrum and explore how would healthcare be delivered in next 5, 10 and 20 years. In my conversations with various industry leaders, they listed the following five as their most significant strategic goals. Number one, make healthcare accessible to everyone. Two, provide more patient centric care. Have their patients engaged in decisions related to their care. Number three, improved outcomes. Number four, better health for their population. And lastly, make healthcare affordable by cutting out waste. We are witnessing transformational changes in every aspect of our life. As we discussed in season 1, with the advances driven by technologies such as artificial intelligence, Internet of Things, big data, and faster networks, we are seeing commoditization of smartphones and easy access to the internet has given birth to multitude of apps which have enabled information at our fingertips. The result of this is a seismic shift in balance of power from sellers towards consumers. Accessibility to information has presented more choices and given us more control. However, we are yet to see a similar transformational change in the way healthcare is provided. We are still interacting with our care providers using 20th century technologies. Patients are still expected to call their doctor's office and speak to their secretaries to book an appointment based on doctor's availability. Patients are still expected to go to the doctor's office at minimum 15 minutes before their appointments, present their insurance cards, wait in the main hall, then wait in the examination room, then finally see the doctor, at which time they will share with him or her the reason of their visit. Doctor may write a set of tests for further diagnosis, and the patient goes to the next round of appointments to get all the tests done and then wait for another call from the doctor's office telling them that the results have come in. Doctor would like them to come in and share the results with you, which could be as simple as writing a prescription for whatever diagnosis were found, or it may be decided that you as a patient needs to go see a specialist, which sets another round of similar processes where the doctor office will fax a referral to the specialist. You, the patient, will wait patiently for a call from the specialist office, and in their due time, they will call you, let you know when would specialist be available to see you. Again, at the time convenient to the specialist. I hope you see the challenge. The balance of power is fully tilted in physicians' favor. Patients have no choice, no control. In the coming episodes, I will explore options on how do we improve accessibility to care. We will explore how technologies in future will enable patient-centered care. What I mean is give you, the patient, control to determine when, where, and how you receive care. In my view, the next 5 to 10 years, we will witness a widespread use of tools that will enable seamless communication between the patient and their care providers, both explicitly and implicitly. For example, patients will use AI powered apps of their choice to initiate an encounter with their primary care physician. How? Simply by answering a standard set of questions. The subsequent questions will be tailored by an AI bot based on patient's answer to previous questions. AI assistant will recommend to physician an initial diagnosis or propose a set of tests that may be required. The physician can accept or revise the set of tests based on his or her experience. All this can be done without physician and patient being in the same room or even online at the same time. At the end of this step, the physician can order tests in their electronic medical record system, and the requisition will flow through to patient's app. The patient will get the lab work done at the lab of his choice, and once the results are available, they are sent to both physician's electronic medical record system and the patient's app. End of the day, goal is twofold. A, improve patient's experience. And two, have them informed and engaged in their care. To achieve this vision, there are several barriers that we need to overcome, such as lack of interoperability between different technology vendors. We need to establish and implement standards that will allow seamless flow of data between systems. Define ownership of patients' medical data. Implement airtight security of patients' data. Now, good news is that over the past decade, we have seen encouraging signs. In addition to traditional health information technology companies, major technology players such as IBM, Google, Apple, Amazon, Microsoft are investing heavily into healthcare research and development. They are developing solutions to capture, store, and process healthcare data. I believe once we harden these foundational enablers, individuals will become comfortable with communicating their medical issues via their smart devices. And telemedicine will become a mainstream medium to deliver care. In coming episodes, I will explore how artificial intelligence will augment clinicians and make them more productive by performing mundane tasks so the clinicians can focus on taking care of their patients. We will talk to experts in population health and ask them how Internet of Things, such as wearables, Apple smartwatch, and Fitbit, and other wearable devices that people are using today, will generate data that can be used by advanced analytics to help identify high risk individuals so that providers can proactively intervene and keep the patients out of urgent care settings. We will also speak to experts on initiatives on improving interoperability of data, and finally, We will explore how new models, such as value based or population based compensation models versus fee for service, can help improve patient experience as well as reduce waste and cost. As I conclude my first show of this season, I hope you will enjoy my podcast as much as I am enjoying producing them. Until next time, adios, ciao, and goodbye.